There is a new alternative for patients that want to replace damaged, unsightly loose teeth or dentures with new teeth-on-4 implants. Replacing the upper or lower arch with dental implants traditionally required 6 or more implants. With teeth-on-4 treatment, all the upper and lower teeth are replaced on just 4 implants. With this treatment, the back implants are placed at a 45-degree angle, and this increases their strength and ability to anchor a fixed bridge using less implants.
Right, so here we can see what the upper denture looked like. The patient had struggled immensely with the denture and it had already been relined several times. The denture was quite thick and quite uncomfortable, and it not only affected his speech but also his comfort during eating. This is a close-up view of the upper jaw and the lower teeth. We can see that there's no teeth on the upper jaw, and the lower, we can see the 6 teeth that are remaining, with the lower right canine tooth with a lot of gum recession and bone loss. This is a close-up view of the upper jaw before dental implants. Okay, hi, my name is Bruno Silva. I'm one of the dentists at the Brighton Implant Clinic, and we're doing a series of short videos explaining some cases that we've treated in the clinic. We're showing you some before and after photographs and x-rays. Hopefully that'll be helpful if you're considering dental implant treatment or if you just have an interest in dentistry in general. The case that we're looking at this morning, basically this patient came to see us. He's born in 1952, makes him 62, 63 years old, and he has no upper teeth and he has a few remaining lower teeth. This x-ray that we're looking at is called a panoramic radiograph. And essentially it's a very good image, or a very good radiograph to use to give us a general assessment of the upper and the lower jaws. So it is an inverted image, so this is the right side. And we can see that at the bottom we only have 1, 2, 3, 4, 5, 6 teeth present. When we're looking at the bone, we can see that the bone is actually holding these teeth. It's quite difficult to differentiate between the roots of the teeth and the jawbone. But in this case over here, this tooth, you can see that there's like a dark shadow all around the root of the tooth. So it's indicative that this tooth has lost all its bone support. And incidentally, this tooth is actually very loose in the patient's mouth. So the patient came to see us actually a few months ago, and his main complaint was that he couldn't cope with a full upper denture. So he had already lost the upper teeth due to gum disease. Unfortunately, with gum disease, we lose the bone that actually holds teeth in place. It usually starts quite quietly, and the patients may not be aware that there's problems going on. And usually the first signs are bleeding gums. If this is left untreated, one will lose the bone that's actually supporting teeth, and teeth will become loose, and eventually they will fall out. Unless any treatment is carried out, this bone loss will continue, and it will have detrimental effects. So he's already lost the upper teeth, and saw him 3 months ago, and a thorough assessment was carried out, and during the thorough assessment the options of teeth replacement were discussed. So with teeth replacement, when we don't have any adjacent teeth remaining, are essentially a full upper denture which he already has, which he's unhappy with, and the second option would be dental implants. Now when we're looking at dental implants can either, in a case like this, support teeth that are fixed, or they can support a denture which is stabilized. Now the two are quite different, and they're applicable and appropriate for different cases. In this particular patient, his preference was to have something fixed. He didn't want to have something that was removable, that he would need to have taken in and out of his mouth. Despite that being a very good solution and being much better than what he had, I beg your pardon, he did prefer to have something fixed. So the first phase of treatment was to actually deal with the upper jaw. As you can see over here, 4 implants were placed. These implants were secured and anchored into the patient's own jawbone tissue. We didn't need to graft any bone because thankfully he had sufficient amounts of bone with which to place the implants. And we can see these implants are quite substantially wide and long, and thankfully they provide good anchorage with which that we could actually support a fixed bridge on the same day. That surgery usually takes about 2 to 3 hours, and it can be carried out under local anesthetic or sedation, although we usually recommend patients to be sedated. It's more comfortable, and it's easier for the patient. So the upper bridge was completed, and we can see that these implants are now joined together. We say they're basically supporting each other and making sure that the bridge is now fixed and firmly in place. The patient has been so pleased with the upper surgery. Incidentally, we did remove this tooth at the time when the implants were placed. This tooth was causing some discomfort, so we removed this tooth at the last surgery. The patient has come back to see us today, and he would now like to have a similar solution carried out in the lower. With only 5 teeth, the upper bridge that he's had on the implants is not functioning to its full potential, because without teeth on these back areas, we're unable to actually bring food together and actually carry out the full action of mastication. So in this area over here, we're going to remove the remaining lower teeth. They're all slightly mobile, and the patient understands that their prognosis is very poor in the long term. So I'm very happy to let you know that the treatment has gone very well this morning. The surgery was carried out successfully, and we can see from the x-ray that 4 implants have been placed. All the implants had very good stability, so they were well positioned and well secure within the jawbone. We use a special device to make sure that we have adequate strength and stability within the implant. And provided that is the case, we then take impressions, usually while the patient's asleep, sedated, and these impressions go to our dental laboratory. Our dental technicians will make a provisional bridge. As we showed you earlier, that provisional bridge is going to be supported on the 4 implants. So this upper and lower provisional bridge is going to be left now for a minimum of 4 months. During that time, we expect to see that the titanium will fuse within the jawbone and that the implants will become completely fused and integrated with the bone tissue. We will recall the patient after 2 months to ensure that the bridges are being adequately maintained and cleaned. During this time, we recommend that patients are using a water jet or super floss and brush to make sure that any plaque debris or plaque or food debris is being adequately controlled and being cleaned thoroughly. After 4 months, we will take some time to make sure that the implants have all integrated fully, and we will then be taking some notes of what the patient likes about the provisional bridges. The color of teeth, the size, the shape, the position can all be altered in order to satisfy the patient's requests and demands. So photographs, further impressions, and consultation between the patient and the dental technician and the dentist will be needed in order to complete a dental bridge that is satisfying the patient's expectations, that's comfortable, and that makes the patient feel confident with their new smile.
For more information, please feel free to contact Brighton Implant Clinic